Hello everyone, welcome to General Psychology, Psychology 101, and today we're going to briefly talk about psychological therapy and treatment. So we talked about psychological disorders. Now, how do we actually treat these disorders? Well, historically, treatments have been pretty harsh and pretty unrealistic, looking at basically drilling holes in people's heads to let the disorders escape. But thankfully, we've moved on from there, and there are two main kind of camps of therapy that are used. First is psychotherapy, that's kind of interacting or talking with another person to try and help them through these processes, or biomedical therapy, that's where we're focusing on using drugs or some other type of biological means of reducing these disorders. With psychotherapy, there are many different approaches that we can take. A lot of them have to do with theories of personality that we talked about before. So for example, we have psychoanalysis. This would be focusing more on these unconscious drives, helping people interpret their dreams, interpret their unconscious motives, and then allowing that to influence behaviors in the real world. Humanistic therapy is focusing more on personal growth. We would use what's known as client-centered therapy, kind of helping people through positivity kind of understand and better accept themselves. We can focus on behavior therapy. That might be utilizing principles of learning that we've talked about previously to reduce unwanted behaviors or unwanted responses through classical or operant conditioning. One popular behavior therapy is exposure therapy. If a person has a specific phobia of a specific object, we would systematically desensitize them to that object and help them kind of realize that there's no need to be afraid of this object after experiencing it over and over again. And additionally, we would have cognitive therapy. That would be focusing on specific thoughts associated with disorders, kind of dealing with not only the thoughts that people have, but also the behaviors. This would be specifically cognitive behavioral therapy, or CBT. This is really the most common type of therapy that's used, especially in many clinics and counseling centers across the country. So how effective is psychotherapy? Is it possible for us to just talk with a person and help them get rid of these disorders? Well, sometimes we see improvement, sometimes we see what's known as a placebo effect. This would be just the simple act of going to a therapist and talking to someone helps a person improve. It's not necessarily the content of the therapy that was helping them, but just the fact that they believe that they're getting help. It's important to track the outcomes of these different types of therapies, to track how effective they are, compare them to a placebo group, and measure using more objective, observable measures whether or not these treatments are actually helping. It's difficult to determine this simply by asking the client themselves. Most of them are going to believe that they're getting help, that they're improving, just because they're going to therapy in the first place. The reason we need to ask whether or not these forms of psychotherapy are effective is because we have another approach. We have a biomedical approach that we can take. There should be physiologically changing the brain's electrochemical states or the way the brain functions through drugs, through magnetic impulses, through electrical currents, surgeries, etc. Psychopharmacology is a kind of subsection of science now that studies the effects of specific drugs on the mind and subsequent behavior. We can have antipsychotics that can treat schizophrenia and other severe thought disorders. We can have anti-anxiety medications that treat maladaptive levels of anxiety. And we can have antidepressants that treat depression and other anxiety or mood disorders. How do they work? Well, they all work by focusing on the brain, obviously, but focusing on neurotransmitters. Specific neurotransmitters are often associated with specific psychological disorders. And so many of these drugs focus on the synapses and where these neurotransmitters are being reuptake and either increasing or decreasing the amount of neurotransmitters within the synapses and within the neurons. There are some other biomedical approaches to therapy. So electroconvulsive therapy or electroshock therapy can sometimes be used in mild doses. Repeated transcranial magnetic stimulation using magnets to stimulate certain areas or regions of the brain. Sometimes we can use deep brain stimulation through implanting electrodes in the brain to implant those areas of the brain that we might not be able to stimulate via magnetic stimulation. And in more extreme circumstances, we might use psychosurgery. And this is not a lobotomy that was used centuries ago. but very precise and careful microsurgeries that are used to address very serious disorders, such as individuals that might be having seizures on a regular basis. So that's all we have for time today. Thank you for your time and attention, and I will see you all next time. Bye-bye.